Hi friends, I have the honor and pleasure of having with me Dr. Deepti Mittal, rank 44, AIIMS May 2018. Heartiest congratulations.
Thank you, sir. Thank you, sir.
Great performance.
Thank you, sir.
So how are you feeling today?
So, I'm not able to still process it really. It's overwhelming.
So did you, like when you gave the exam, what was your feeling when you were giving the exam? That did you anticipate that you will get such a rank?
No, I did not. I was only trying to improve from my November performance, meaning I knew ki I had studied 6 months, so I wanted to just improve upon that. Meaning I did not want ki my studies, meaning I was in the right track. I just wanted to know that.
So what was your rank, may I ask you, in the November exam?
Some 3500 something, I do not.
Okay. So from there you have improved to a rank of 44 this year.
Yes,
Yes. Within 6 months of effort.
Meaning I was only aiming for improvement.
Okay, and but it is awesome improvement. I would like to actually congratulate
I
you
was
on your
overwhelmed,
efforts.
meaning I could not believe. I checked my roll number. I have no idea how many times.
So are you now able to believe it now?
I don't know.
And now you joined us in your foundation year.
Yes,
You joined us in your
in
third
my-
year.
in
Then
my
you followed up with an internship, and then you followed up with a fast track AIIMS TND
with
that
AIIMS
we.
TND, with the aim of AIIMS only. That.
So how was your experience when you entered DAMS for the first time in your third year? At that time, you would have started studying, or maybe you would have just started getting oriented to the system of PG entrance. How was your experience at that time?
Even I was kind of apprehensive while joining. Meaning I joined late only, meaning after 1-2 classes. But after attending classes, now I got to know meaning concepts what they really are. Now I got to understand meaning. Yours was only the first class. Now the way you correlated radiology with pathology.
So did
Then,
you enjoy that concept building part at the time?
yes.
And did you feel that that kind of filled the lacuna that you were looking for in the teaching part? And
In medical meaning in our colleges, that is definitely lacking, I feel, in our colleges, concept building meaning.
so you started, you initially for the first 2 classes you were a little reluctant to start early, but then gradually you started to enjoy it at that time.
Yes, I enjoyed.
And then you found it, you were telling me when I was talking to you that you found it a little difficult with internship to balance study. Was it?
Depends on the posting, ki what kind of working hours you are having. So yeah, it was not easy for me. Meaning it was kind of difficult only. Meaning I was not able to either ya to read for tests या फिर attend the tests on time and stuff.
So then when you followed up with the TND this time, you were able to push in more effort.
Meaning when I saw the paper, AIIMS exam and NEET exam, and I was like ki most of this stuff it's there in the notes or the TND. I just need to study, meaning I just need to regularly like study and complete it once, twice, or revise it. So that's why a fast revision
So I think
kind
giving
of.
the November exams gave you that faith into the notes and the material that you have,
Yes.
that this is going to help me if I push in more hours of study.
When I saw the AIIMS ka paper, November AIIMS, so I was like, it is kind of doable. Meaning I can see the psychology of the examiner. Meaning why they are asking, what they are exactly asking in that question. Meaning what exactly do they want from us. So meaning especially for AIIMS, I felt ki I got them. Meaning I had the hang of exam. That's why meaning I was targeting for AIIMS.
Any particular teachers that you like to mention today, on this day when you feel that they made a difference in your understanding and learning?
All the major subjects, surgery, medicine, obs-gynae, all, meaning all. Surgery, Dr. Rohan Khandelwal, I remember teaching in our foundation batch. Surgery, TND, I did not attend in my internship, postings and stuff. But still, when I was giving the exam, now I could remember from 2 years back whatever sir had taught in the class. Medicine is Dr. Arvind, there's no comparison, meaning the concept building that is there. CVS especially, meaning it is such difficult, meaning right from the pulse, heart sounds, murmurs, meaning meaning theory mein I'm not sure even now ki I can pick up a murmur clinically, but at least theory mein I know what is the mechanism. So meaning that kind of
I think
basics.
Arvind teaches very beautifully, and I
there,
want to,
there are no words only. Meaning obviously the concept.
he is like Harrison, I think. But a lot of students, they come and tell me after they have, gotten a beautiful rank like you have done. They come and tell me that, they feel he's like a talking Harrison
He
in simple
can
words.
meaning Harrison is meaning a very beautiful book if you understand it, and the person who can explain that, so he must have like meaning what kind of concepts he must have. He is
This
able
year
to
we have
explain it
started. This year
beautifully.
we have started a new initiative that we are now
Yeah,
doing a monthly Harrison-based discussion by Dr. Arvind,
yeah.
especially for the regular batch students and
Yes,
the interns
I
students.
I downloaded that video like uh, 3-4 days back. I've not yet seen it, but obviously I'm gonna see it. Meaning I'm so
That is aimed more for people who are building concepts right now. When you are like one of the top student right now, I'm very happy to be sitting with you, and I would like to tell you that you have come back. You have come up a very long, a good way in 6 months. It's a good improvement, considering from November to May there was not much time, but you kind of improved very well. I think
meaning
this
you.
can serve as an inspiration to future aspirants as well.
Meaning now there are days when you feel like you're not getting stuff done, you are very depressed. Meaning the trick is just to keep doing. Meaning you are allowed to have a bad day, but you're not allowed to like give up. So one day it's okay. Meaning if you waste one day, but start again next day. That is the most important part. Ki,
How was your experience with that AIIMS TND that we have done recently? You joined us with for that TND. How was your experience with the test and discussion, question papers, teachers?
the very important part was कि it was scheduled very well. We were able to complete the course well before time, meaning before time and it's obviously meaning tests, the anticipation of the questions, it's obviously good. Meaning some subjects especially I remember radiology, meaning your class, and the way you were anticipating the questions now, I remember that growing skull fracture question, meaning you were like ki, I anticipate this question, and you also said na ki why I am anticipating. I was not able to exactly comprehend both thought process, but then it was there in the exam and I was like okay.
No, my thought process was that every time they are going towards emergency, trauma, injury, so they have to go a level up. So that is
It was a completely new topic, meaning I've never read only, meaning I guess growing skull fractures, but it's everything, meaning
I
especially
was
the
very happy
discussion
with
classes.
the aortic dissection as well. This
Yes.
time I was very happy with it because I feel emergencies are very important for AIIMS.
AIIMS discussion also we had na 3 sessions we had, and the PGI discussion, those were like bilkul consolidated notes. What matlab, that is exactly what you need, but to understand that you have to go back and वो सब, meaning to retain that, meaning you cannot just retain as if random facts. Now you need to have basics upon, but finally you need to remember that much only. So those are like good for revision, meaning those are exactly what you need. But does not mean कि you attend only that, क्योंकि you cannot understand that without the previous these AIIMS and PGI discussion classes I found really helpful.
So, do you think that we are able to, because I'm putting a direct question to you, do you think we are able to anticipate the pattern of the exam? Do you think our teachers are like looking,
Yes.
find out topics that can be asked?
Especially with some subjects, especially, meaning I felt, meaning obviously you cannot know the whole paper, but with some subjects I felt key.
Any, I would also like to, today take, ask you directly, like, you have given this AIIMS paper, and so can you advise future aspirants, like, what topics do you think are important for AIIMS? Because some people listening to you today are, looking for a direct advice if he is appearing for the November exam. Can you, point out some topics to them?
Emergencies are especially with AIIMS, I feel like you need to have common sense, meaning a lot of common sense, meaning sense of what is right and wrong. meaning you need to have your basics and your common sense, then you can build upon that. Meaning every question you would not be knowing, every meaning topic you would not have read, but if you have basics and common sense, meaning if you do something, study less topics but go all the way. And meaning topics, so meaning teachers obviously highlight during tests and stuff only, meaning mostly yeah, emergencies especially I would say AIIMS के लिए, meaning subject wise so it's all covered only, meaning mostly.
Do you want to say something motivating to the listeners who want to, learn from your journey and be in your place next year?
I would say, meaning it's really important to be consistent and have faith in yourself, meaning probably the most important thing you need to have. I meaning you should not give up, meaning even if you're not able to solve few questions, it's okay, meaning move on to the next one. Meaning always keep, meaning even if you're feeling like you're not able to figure out something, there's no hope, it's okay, meaning take the one small step in that direction. Meaning staying there though would not give you any solution only. Now if you feel like you're not understanding something, meaning one day you're very depressed, you're not understanding something, but it's okay, meaning start with some topic, you will eventually. I remember as biostatistics from PSM, meaning very important topic and not easy to understand only, meaning obviously no one ever explains, but then on DAMS eMedico's app I saw bio,
course, yes.
meaning keep on looking, meaning do not ever give up, meaning ki always try, meaning however small step that is, take some step in that direction, it will eventually lead somewhere. Meaning finding that videos, those were probably like the most informative 4-5 hours.
Yes.
Meaning I made notes, I solved all the questions sir was discussing, meaning a must watch video. Meaning
Did you enjoy the experience that we had thought of putting such videos on eMedicos?
I watched, meaning these 3-4 months now I watched mop-up videos. All of the, I did not more matlab, case discussions not all, but mop-up videos is most all only, meaning
Tumors one, I think.
yeah, genetics, neoplasia I also did, contraceptives I did, meaning it's really nice, like consolidated information plus revision and PSM ones, so meaning I obviously enjoyed.
So would you be happy to recommend DAMS to your juniors as well, like with your experience with us?
Obviously, yeah.
We are very proud to have you here,
yeah,
and we are very proud of your achievement. I would like to take this moment to congratulate you, your parents, your family for on this landmark achievement. And I'm sure you will be doing well in your PGI result also. Let's hope for the best.
Yes.
And I'm sure you will be doing well in life. I wish you all the best.
Thank you. Thank you, sir. Thank you, sir.
Congratulations.